This is Asian Insider and I'm Nirmal Ghosh. Now today we deal with a very grim subject, India. Hospitals are utterly overwhelmed, patients are lying on the floor, there is not enough oxygen, an oxygen cylinder costs thousands in the black market, people have been left to fend for themselves, and people are dying en masse, and I mean en masse. The cumulative death toll from COVID-19 has soared to over 219,000 and is going up by over 3,000 per day. And that is almost certainly an undercount. The real figure could be between 5 to 10 times higher than what is being reported. At least 3.4 million people are apparently being treated, which is again very likely an undercount. The health system is near collapse. And the rest of the world is watching in utter horror, frankly, as what is happening in India is also putting the rest of the world at risk. Now, there are many aspects to this deep and ongoing disaster, and to discuss just some, today I am joined by Gautam Menon, Professor of Physics and Biology at Ashoka University in Sonipat. And I am joined by my colleague in Bangalore, Straits Times, India correspondent Rohini Mohan. Thank you both very much for taking time out to join Asian Insider today. Professor Menon, if I may start with you, could you give us a sense of whether on current trends, India is in for more weeks of this very grim situation? Or is there some hope of getting on top of the virus in the foreseeable future? And what has to happen to get to that place?
Well, at the moment, most models suggest that you should be seeing a peak in another 10 days to 2 weeks from now. There are some encouraging signs that it could happen before that. The cases, the total daily cases is around 350,000 per day. And that's down from a high of about 400,000 per day. And whether that really reflects a reduction in testing isn't completely clear. We'll have to look at this trend over a few more days at least to see whether it's cemented in. But I think, the best case scenario, we've seen it turn down. It's sort of going to come down from now. Worst case, the actual numbers will continue to rise for another 10 days to 2 weeks, even though it may not reflect in the official statistics. But hopefully after that, we should see a sustained downturn.
And I suppose vaccination will be one of the keys to getting on top of it as well, right?
In the long term, certainly, but vaccinations will do nothing for you in the short term, will do nothing for you over the period of about a week to 10 days or 2 weeks, which is really now the issue. The problem now is that you have people crowding hospitals in very large numbers. And that incredible strain on the health system is what is really leading to all of the pictures that you see on news media flashed around the world. Hospitals full, people pleading for oxygen, ICUs full. That's really the reason. Vaccinations won't solve that problem now, but they will be certainly the only really long-term solution.
Rohini, we are getting a lot of news from what seem to be the worst affected places, like Delhi and the National Capital Region and Uttar Pradesh, for example. What is the situation in Bangalore? Can you give us a sense of the anxiety on the ground? I believe you are on lockdown. How badly has this affected life and people?
So the reason to go on lockdown after a lot of reluctance from the government was that the numbers just weren't coming down, infections were spiking. So the only solution was to have a lockdown. They tried a weekend shutdown first, and that wasn't enough. So they have extended it to mid-May, which, as Professor Menon said, is probably where the numbers will peak even more. Bangalore, actually, at least in terms of hospital beds, is the one that has the most number of beds per, I think, a million population in the country, and still it is struggling. There's lots of private hospitals here, and still people are outside, no beds are available. It is those heart-rending scenes that we see from Delhi are not very different here. It's pretty bad here as well, and it got bad in the last, I would say, 4-5 days. It got much worse. I'm also hearing that other cities like Chennai will get here pretty bad soon. And this is because the cases are increasing, and those doctors and all that told me that, once somebody is admitted, at least 7 or 8 days, they are going to be using that ICU bed, that oxygen concentrator. And so it's not going to be easy to have that turnover. But the number of patients coming in for admission is much, much faster. So this is something that, there is a resource crunch here. The government, state governments are trying to expand capacity. There are private entrepreneurs who are trying to set up temporary COVID care centers. All of this is happening in a rush right now, but it's only, I think, in next 1 week, we'll see if it works.
Tell me, Rohini, sticking with you for a moment, more than 40 countries have committed or have sent medical aid of some description. A lot of aid has already arrived. Is there any evidence that this aid this equipment, the oxygen and so forth, is being effectively deployed and is making any difference yet?
That's the sad thing, that there was a lot of relief when a lot of governments pledged that they'll send oxygen concentrators, and even Singapore allowed cylinders to be sent. So this is something that people expected some relief from it. There is, of course, internal competition between different states because we are all struggling, and the worst affected states need it now, not tomorrow, like right now. So there are people still dying outside without access to oxygen. So oxygen is something that I think that's the first priority, but it's not come from, people are saying that the customs hasn't cleared it. Every imaginable bad bureaucratic block right now exists.
Professor Menon, it seems almost callous to talk in analytical terms when one is in the midst of an ongoing tragedy like this, but we do have to ask ourselves what lessons are to be learned from this. There have been allegations of complacency, vaccine inefficiency, messaging. What would you say are the lessons?
Well, all of those that you just mentioned. And I think a certain level of complacency had set in because after the cases in the first wave peaked around the middle of September, we saw a sustained decrease, which really didn't sort of show any sign of a peak during the November and December season, which is the season for festivals, the season of puja in Bengal, etc. So that, I think, led people to think that maybe there's something special about the Indian population that protects it in some way. Maybe we're over this. Maybe we won't see the sort of devastation that COVID-19 has wreaked on other countries, for example, Brazil. That turned out to be wrong. That seemed to be misplaced. And post-January or so, there was a gradual opening up. Schools opened up in some areas outside the main cities, and that may have driven some part of the new wave. And of course, variants. Because this is a virus that changes, it mutates. All viruses do that. And when they mutate in a way as to become more infectious, more transmissible between people, that's when you have to watch out. One is transmissibility, and the other, of course, is lethality. I mean, does the virus kill more people on average than in the earlier strain did? That, I think, is really what happened around the middle of February. The earlier strains that were less transmissible on average seem to be replaced by a bunch of new strains, one from the UK, the B117 variant, mainly over the north of India, a variant called the B167 variant. The B116 variant, 117 variant in the west of India, other variants in the east of India, other variants in the south of India. All of these seem to have become important all of a sudden. And they seem to have led to this sudden spike in cases. You could have argued that that's the point at which we should have looked forward and tried to understand what would be the consequences of this increase and tried to put in the oxygen requirements, all of the other infrastructural requirements that we needed, as well as to sort of beef up hospital capabilities at that point. We didn't do that at that time. We did go somewhat rashly in for a full-scale election campaign, approved by the Election Commission, which was a mistake. It had lots of people crowding. We had religious events like the Kumbh Mela, which again had a lot of crowding. Of course, some care was taken about it. It wasn't as though it was completely a free-for-all at that point. But all of this, I think, added up to our being unable to prevent this very sharp rise. Whenever viruses spread, whenever you have an epidemic, you will see cases. The only question is how fast do they grow? And can you keep your medical system in such a way as to be always ahead of that particular curve? That didn't happen.
Right. Rohini, we hear two quite different messages from India, from our friends and relatives and the media and from the government. As Professor Menon was saying, Prime Minister Modi continued to hold political rallies. Several parties did that in Bengal. They allowed huge religious gatherings, but it has also tried to censor critical media, articles, tweets, and so forth. So what is going on?
Yeah, we've even got ambassadors and diplomats in other countries like Australia writing to newspapers saying don't cover it and you're misleading people. But I think the image management is part of definitely government trying to cover up a really catastrophic moment. But I think real numbers on the ground are, it's very hard to hide it from the people in the country. When you've lost family, when you've lost, someone just very close to you, you're not going to believe numbers that say that no one has died in that district or in that area. For example, if I can just mention one, I just noted it down. Like, for example, in Bhopal, which is the capital of the central Indian state of Madhya Pradesh, the government says on May 2nd, 104 deaths, but the crematorium's total is 2,557. This is the gap. And this is not one, this is just one example, and it's across different places. Local media has been covering the gap in deaths, and death is one indication of how bad the situation is. I wish we could know how fatal this way, some of the variants are, but right now we are seeing deaths. We don't know if it's because of the variant or if it's because people just didn't get access to medical care. There have been scientists who've written to the government asking for more data to be released that the government does collect, and so that they can analyze better. We can make better decisions with better scientific decisions. So there is a gap in between what the government says and what people are experiencing, but it's not fooling anyone, at least on the ground.
Professor Menon, we have seen obvious quackery. I mean, I can think of no other word, frankly. And it's not exclusive to India, but it's obviously, given the situation, it's very obvious. The scientifically ignorant quackery from political leaders, sometimes at the very highest level. Do you think that has played some role in this devastating tsunami of infections and deaths that we are seeing?
Not particularly quackery. I mean, the silly statements have been made. I'm not sure anyone takes them all that seriously. I'd be more concerned about other things, such infrastructure, and particularly the reasons why there is some amount of hesitancy. I think people are seeing a level of crowding in hospitals. Tests are not available. So even if you're ill, just to get tested to demonstrate that you have COVID-19 has become a huge problem. It takes 5 to 6 days to be tested in the first place, and then a few days after that for the results to come. And people look at these, and there is this worry that if I go to get vaccinated, I'm just in the midst of large numbers of people, and I may contract the disease just while on the way to getting myself vaccinated or tested or something. We haven't managed that very well. And I think that's a reason for some amount of hesitancy at this point. I would not, I mean, the quackery is part of everything. I don't think anyone takes it all that seriously. And I don't think it has had a major impact in the way people deal with COVID-19 in India.
And Rohini, back to you for a second on the role of the media. You did mention that the media has been exposing the true situation on the ground and so forth. But I've also seen some analysts and commentators saying the media bears some responsibility for not being, forthright enough, that a lot of the media has been cowed under this administration. I wonder what your thoughts are on that as a journalist out there.
Both exist. There's a lot of people covering, what is really happening. There are also a lot of people who, I think it ranges from wanting to give, not hold the government, at least the central government accountable. There are no doubts that people are holding their state government, local government responsible. But the popularity of Prime Minister Narendra Modi sometimes deters some people from holding him accountable for certain decisions. It's a very centralized government. The first wave of COVID pandemic in India was handled in a very centralized way. Most of the decisions were happening from the Prime Minister's office. So this is what people expected now as well. There were criticisms of that, not that that's the greatest way to handle a pandemic, but that was what we saw in the first wave. And in the second wave, there has been much more of a held back response from the central government. So the media may have questioned this. The other is, I think, a more legitimate criticism may be looking within. So there have been commentators writing about, should we blame ourselves as Indian citizens for having exhibited lax behavior, not following rules? I would say that there is blame in the population. I would place some blame on ourselves as well as the government. And there has been some attempt to kind of hold back or to censor information that some media has reported, to also censor tweets that desperate families had posted saying that there is oxygen that is getting over, my mother is dying outside a hospital. There was even an attempt to censor that. Certain state governments like Uttar Pradesh under the Chief Minister Yogi Adityanath have tried to have threatened to confiscate property of people who have criticized the government, and courts across the country have clamp down on this kind of behavior. They've said you cannot attack or punish people in their desperate situation for simply speaking up and asking for help.
Professor Menon, a last word from you. What is your predominant takeaway from this tragedy?
I think the first thing is that we allowed ourselves to be complacent, and we believed, at least I think a good amount of messaging was centered around the idea that India was exceptional in some way and would not have the same fate as the other countries who'd gone through multiple waves. We know now that that isn't true, and we need to be as vigilant as possible to look for further possible surges in the future, further waves that could happen. And there's a lot of stuff that we need to do in order to prepare for that. We need to get better genetic epidemiology in place to figure out where are the new variants. We need to be very, very much more watchful at the local scale for sudden increases in cases that are unexplained. We need to understand all of this. The other point is that the television cameras are focused on Delhi and Bombay and the big cities of India. But the tragedy that is unfolding in the tier 2 cities, the tier 3 cities and the rural parts of India is an untold tragedy. Relatively few people are speaking about it, but in a sense, that's really where India lies. It's not so much in the cities, but the bulk of the population is still largely in non-urban areas. And it's their needs that we should also be cognizant of, even while the television cameras and the news press are focused on the large cities. The last point that I want to make is that this is, in a sense, an opportunity. This is completely a one in a lifetime, one in 100 years event. So for us to think about the role of public health, of easily accessible, uniform, inexpensive, and publicly available public health system across India, this is something that we've had some amount of success in. It's been homogeneous across states. Some states have done relatively well. Some states have done badly. But this really is a chance for us to do something new and to think about this anew and to put resources where they can make a difference.
Very well put. Professor Gautam Menon, Rohini Mohan, thank you very much for joining Asian Insider. I'm afraid India has not seen the worst of this crisis yet, and we just have to hope that the system is resilient enough and the foreign aid makes a difference in the days ahead. For Asian Insider, I'm Nirmal Ghosh.